Good afternoon, everybody, and thank you for being here on this Valentine's Day. It's a reminder to all of you with significant others, don't forget, it's Valentine's Day, and make sure you take the opportunity to tell the special people in your life how much you love them. And I will do my very best to make sure I don't forget that myself. We call this press conference because I briefly want to go over some COVID updates and then give you the opportunity to ask questions that you may have about COVID or the legislative session, whatever. You can see Dr. Joe Canner is not here with me today, but he and others from the Department of Health will be holding a special technical briefing tomorrow to discuss updated guidance for K through 12 schools and early childhood education, as well as Mardi Gras safety. He will do that based on new CDC guidance that came out towards the end of last week. So if you do have detailed questions about those issues, please just hold on till tomorrow and you'll be able to have those questions answered directly by him. Otherwise, if you ask me a question, I'll do my best. While we remain in an Omicron-fueled surge, we are definitely on the downswing, and I stand before you very relieved today. We have made great progress as a state since our Omicron peak, which now we know occurred between about January the 18th and January the 22nd. Today, we are still reporting a lot of cases. 3,039 new cases since Friday. To be sure, that's a lot. But I want to put that number into perspective. Last Monday, when we reported 3 days worth of cases, we reported more than twice as many as we're reporting today. 2 Mondays ago, it was 3 times as many as we're reporting today. So that'll show you just how quickly we are making progress, and it confirms that we are trending down. Unfortunately, however, we continue to report a high number of deaths. Today, we're reporting 41. And by the way, that brings us to 16,217 since the start of the pandemic. Every day that we report deaths is like a gut punch. And even as you do better in terms of cases and percent positivity, hospitalizations and other indicators, when you're coming off of a surge, the last number to really respond is the death number, because deaths are what's known as a lagging indicator. And so there are still an awful lot of families across the state of Louisiana who are suffering with the loss of loved ones and who will continue to suffer the loss of loved ones going forward. So please keep them in your prayers. And in fact, over the last 7 days, we've reported 201 total deaths. So things are improving. That's the bottom line. We do have a ways to go. On hospitalizations, today we're reporting 1,135 patients in the hospital with COVID-19. That is a good drop. It's been fairly steady over the last couple of weeks, and it's certainly welcome news. The 1,135, that's roughly half of our peak hospitalization from right around January the 20th, when we reached that peak. But the number of hospitalizations remains about 4 times what they were before the Omicron surge started. So that puts it into perspective. We still have a lot of improving to do. And I also want to talk about percent positivity. Today we're reporting and when I say today, I'm talking about the tests that we're reporting today, right around 8% of those were positive. There was a time in January, right around January 22nd, when 35% of our tests were positive. So that too is good news. With respect to COVID, I also want to address the public health emergency, which expires on Wednesday. The short answer is I will be renewing it for another 28 days. It'll expire on March the 16th. But as you know, what's contained in the public health emergency proclamation has changed over time, and that changes as our cases rise or fall, hospitalizations rise and fall as vaccinations and other therapeutic interventions become available. And quite frankly, now we also have to take into consideration the percentage of our population who have immunity either from vaccination or natural immunity because they have had COVID or both. And certainly we don't expect, I hope we never go back to the kind of strict mitigation measures needed before vaccines. I will tell you that the proclamation I will sign tomorrow will maintain the public health emergency. It will not include any mention of masks. However, as I mentioned, LDH will be given additional guidance to K through 12 schools. It's about quarantine, isolation, exposure, those things that the CDC updated in their guidance last week. And that guidance from LDH will not have any mask mandates either. Now, just to be clear, you're still required to wear a mask when you're in a healthcare setting, which is not something that's in my proclamation. And quite frankly, it is a good idea, especially when you realize that we still have every parish in our state at a high level of transmission as defined by the CDC, which is 100 cases or more per 100,000 in population over a 7-day period. You also have to wear masks if you're on transit because of the federal TSA order. So if you're going to get on a plane or a bus or a taxi or whatever, that's controlled by the federal government. And obviously local government remains free to impose mask mandates. A business owner may choose to do that, or a school may do that. So if you're visiting a business or a school or whatever that has a mandate in order, if you're in a parish that has one, or city, whatever, please do as you're asked and be respectful of one another and take care of one another. And everyone should know that the CDC still recommends masks for people who are at a high risk of severe case of COVID. That includes people who are unvaccinated. It also includes people who are immunocompromised, people who are old enough that makes them more vulnerable to the disease, or having comorbid health conditions. And quite frankly, it includes all of us when we are in large crowds and you don't know whether the people you are with are vaccinated. The CDC recommends that we wear masks in those circumstances, especially if that gathering is indoors, and certainly while transmission rates remain high as they are currently across the state of Louisiana. And right now, obviously, you're more likely to have a severe case of COVID if you have not been vaccinated, fully vaccinated, and then obviously boosted as well, because we know whether you have immunity through COVID that you've contracted or whether you have it through vaccinations, it does wane over time. And so those boosters are very important. When I'm signing the order, though, I'm taking a look. We are actively working to figure out what we need to maintain, if anything, as we move forward that is in the proclamation. You know, I'm mindful that a number of states have allowed their public health orders or proclamations to expire. I've decided not to do that today because we still have 1,135 people in the hospital today, and also because every parish remains red or in high transmission, as I mentioned to you before. But as the variants change, and you know, for example, with Omicron, where we had a more transmissible form of the virus, but less virulent, thank God, you know, it is more important to focus on hospitalizations than on cases, and that will guide our decisions more and more going forward. But before I lift the public health emergency order, which I may do on or before March the 16th, either by letting it expire or by issuing a new proclamation, you know, terminating it, I have directed my office, GOSEP, the Department of Health, the National Guard, and the Division of Administration to ensure that there aren't any significant adverse consequences to doing so. You know, so for example, today we have right at 1,000 National Guardsmen who continue to work every day on COVID-related efforts. We have 42 Title X service members. These are active duty individuals who are in our state helping out. I wouldn't want to put at jeopardy our ability to continue to use these personnel at 100% federal reimbursement. And by the way, the 10 active duty Title X Air Force personnel are in Monroe. at St. Francis Hospital. They began their operations there on February the 8th. They're scheduled to stay until March the 10th. The National Guard today is supporting 35 open medical test sites, 6 food banks, 28 vaccine sites where our soldiers actually administer vaccine. And just to make sure that people can be aware and appreciate the work that the National Guard has done, they vaccinated 223,779 people so far and tested over 620,000 people across the state of Louisiana. They've also done close to 10,000 hotshot missions where they're transporting things to hospitals and other healthcare providers and so forth. And that includes about 116,000 vaccine vials that they have moved across the state of Louisiana to make them available to healthcare providers. So I can't thank our Guardsmen enough for the work that they have done and continue to do. And again, before we entertain the possibility of not renewing the public health order, I just want to make sure that it's not going to interfere with the important work that is being done by service members, by healthcare professionals across the state. We also want to make sure that it doesn't interfere with federal funds or increase our non-federal match obligations or the flow of resources in any way, especially as it relates to our ability to help hospitals and other healthcare providers across the state as they request. Also, it is Mardi Gras season, and LDH will discuss Mardi Gras in more detail tomorrow and how people can engage in Mardi Gras activities safely. I do want to ask everyone to weigh their risks before participating, especially indoors with large crowds, and consider if there are things that you should do to protect yourself or whether you really should go at all. And this is actually true for all activities, not just those related to Mardi Gras, but it's especially true for those people who are old enough to be more vulnerable to the disease, people who are immunocompromised, or people who have comorbid health conditions. And it's also true for those who are unvaccinated. So it is not too late for people to get vaccinated. And if you are eligible for a booster, please get your booster as well. You can do that now, and you'll actually have supercharged immunity by Fat Tuesday. Finally, before I take questions, just a quick comment, because I've been asked a number of times. You know, I don't know that I've ever done it. Maybe I have, but it's certainly not my practice to talk about vetoing bills that haven't finally passed and been delivered to my office, because you never know what those bills are going to say in advance of that, and you certainly don't know what kind of votes they're going to receive in the House and in the Senate. So the simple answer to the questions that haven't been asked yet is I haven't made a decision. But at the appropriate time, I will certainly let you know. I do remain very concerned about making sure the maps are fair, that the Voting Rights Act is complied with, and I've said earlier, for example, that when you have a state that over the previous 10 years, the population changes, and actually the percentage of the population increases in terms of the African American population, and it's now a third of the state, that where you can do it, a third of the districts should be African American majority districts. And so hopefully there'll be an effort in that direction in the redistricting bills that we're going to get up here to my office. So at this point, I will pause and take some questions. Yes, sir.
The House and the Senate have both advanced out of their chambers congressional maps that include a single majority black district. Yeah. I want to know from your perspective whether you think those provisions or whether those proposals would violate the Voting Rights Act.
Yeah. Well, I think they're certainly very problematic, and I've mentioned that particular bill before. And neither, those are two separate bills, by the way, so not a single bill has received a majority vote in either the House, I'm sorry, in both the House and the Senate. But there you have 6 districts. That's what we're entitled to according to the latest census. A third of our population is African American. And so if it can be done, I believe that we ought to have 2 of the 6 districts, 1/3 of them being majority African-American districts. Where those maps can be drawn, they should be. I believe that there have been a number of bills and or amendments offered that show that it can be done. So I believe that it should. And I think it's right. I think it's fair. And therefore it should be done regardless of the Voting Rights Act. But I also believe the Voting Rights Act speaks to this as well. And that the bills will be problematic if they don't do that. So that'll be one of the things that certainly I'll look at when the bill comes up here. Greg.
Is that the map that you're most concerned with? Is that the Senate and House are also working, of course, on their own state map?
But, you know, I'm concerned about all of the bills. Look, I was heartened today because the House and Governmental Affairs Committee did take up a bill that was authored by a Republican, Representative Barry Ivy, that did create a net new African-American district with respect to the Supreme Court. I don't know how far that bill is going to get, but it did leave the committee and it's headed to the floor. But other than that, we haven't seen any of the bills that have actually advanced out of committee yet create a net new African-American district. And that's true whether you're talking about a 5-member PSC map, any other 7-member Supreme Court maps, the 8 elected members of Bessie, the 39 elected members of the Senate, or the 105 elected members of the House. And so the principles would seem to me to apply to all of those maps. And, you know, for example, in the House and in the Senate, it doesn't seem right to me that the number of minority districts would remain the same when the percentage of the population that is African American in this census is higher than it was before. It's basically 1/3, and yet there's no new African American districts in those maps that are being taken up. So I do think it is problematic, and you know I'm hopeful because none of these bills have finally passed. None of them are on the way to my desk, and so there's always an opportunity for an amendment to be offered and adopted that would do things that I think are right and fair and required by the Voting Rights Act. Yes, sir.
I want to ask, just lost my train of thought. The Bessie bills, adding a 3rd majority black district there.
Yeah. Well, there are 8 elected members and there's 3 appointed members. And so 1/3 of 8 isn't 3, and it's more than 2. So that's not a bill that I will lose sleep over if there's not a new African American seat. But my point was, if you add up all of the bills that have been offered, other than Representative Ivy's bill today, by Republicans and have actually moved through the committees, whether you're talking about the PSC bill, the Bessie bill, Supreme Court bills, Congress, House, and Senate, none of them created a net new African American district, even though it's 33% of the population today, and it's actually grown as a percentage of the population over the last 10 years, as reflected in the most current census results. Yes, sir.
When it comes to vetoing a bill, how concerned are you that when you're thinking about vetoing a bill, how much consideration do you put into whether or not you will be overridden?
Well, I mean, you always think about that, and which is why you have to see what the vote is that a bill passes by. Is it a 2/3 vote or is it not? And if it is over a 2/3 and you have serious concerns with it, you have to then engage in conversation with a number of members, House and Senate, and see how that will work out. But quite frankly, it hasn't been the overarching concern that I've had in the past, is whether I believe the bill represents good public policy, and if the answer is no, do I think the policy that is contained in the bill is bad enough that it warrants a veto? And that's the primary consideration. But look, I think any governor who tells you that he or she vetoes bills irrespective of and without considering the likelihood of an override, I think they would be fudging just a little bit. Yes, sir.
District Attorney Belton, 3rd District Attorney Belton was here today to meet with the Legislative Black Caucus to give them an update on the Ronald Green case and a timeline that he followed. Of course, you met with the caucus last week, or maybe it was a little over a week ago.
I think it was, almost 2 weeks ago.
I wanted to ask you one question revisiting that. In that last press conference, you said that you had trusted the state police to do the right thing. Do you believe that trust was well placed?
Well, look, I always trust that the people who work for me are going to do the right thing. That certainly includes the state police. And I also said that based on questions that I had received in that press conference, that we would be checking to see whether anybody in the state police had actually provided knowingly false information in an effort to mislead anyone. I think that was the gist of the questions that I had been asked. And following the press conference, I did meet with Colonel Davis and made sure that he was aware of the press conference and the representations that I have made, and I'm certain that he is on that task right now. Yes, sir.
You know, there's no indication that these congressional maps are going to change before they get to that there's going to be some significant change of heart on the part of Republicans in the legislature before it reaches your desk. I mean, why wait until it reaches your desk to let it be known what is or isn't acceptable?
Well, first of all, I think I've said what I would prefer it to contain, and I believe that that's what's right. I believe that's what's fair. I believe it's what's required by the Voting Rights Act under the circumstances here in Louisiana presently. And I do, while I think it may be not a likely outcome, I do have hope that a number of legislators who heretofore have resisted every effort to increase the minority districts will change their mind, that they will see that it is the right thing to do, and that if by not doing it, they run a very real risk of having, for example, the courts to intervene and that sort of thing, which should not be necessary. We can all do math. 1/3 of 6 is 2. Can 2 be drawn? The answer is yes, in any number of ways. And so, having said that, I'll go back to what I said, which I tried to say in an effort to get you not to ask the questions. But I don't have a practice of announcing in advance that I'm going to veto a bill before it reaches my desk, much less one that hasn't even received the final votes in both chambers. So I'm just not going to do that. So we don't have another press conference scheduled right now during the remainder of the special session on redistricting, which hopefully will conclude before, but has to conclude no later than Sunday. But obviously, if we need to schedule one, we will do that, and we will let you know at that time. Thank you all very much, and God bless.
As I showed.
I'm sure you fully expected that to be the case.
Yeah.